This is RK Verlan Bakaton presenting the Skyscape Medical Library application. The purpose of this presentation is to provide a summary and analysis of the said application along with its relevance to nursing practice. This application is a free medical library app that includes a comprehensive drug guide, Skyscape Clinical Consult, and a medical calculator. Skyscape was made for healthcare professionals, including physicians and nurses. It can also be a good source of information for nursing and medical students. This application can be downloaded from the Apple Store and Play Store for free. Skyscape can be a great tool for nurses as it provides a comprehensive drug guide that includes uses and dosing, indications, warning and precautions, adverse reactions, drug pricing, and availability. For instance, when a nurse is administering lisinopril to a patient, the patient asks about possible reactions to the medications. The nurse can quickly type in the medication and click Adverse Reactions to show some examples. Skyscape can also provide information about medical diagnosis and various tests. For example, a new nurse is getting an admission from the ER with a diagnosis of sepsis. Before the patient comes up to the floor, she can quickly look up sepsis in Skyscape clinical consults and see possible physical findings, blood test findings, and treatments to expect. Skyscape also provides medical calculator that can aid nurses in computing medical dosage formulas and equations. Examples of formulas relevant to nursing is the body mass index and Parkland equation for burns. Skyscape is easy to navigate and learn. Upon clicking the application, the user is brought to the main menu page. There are various options for resources embedded in the application. I have inserted arrows to highlight the main resources addressed in this presentation, which are the Skyscape Medical Calculator, Skyscape RX, and Skyscape Clinical Consult. The application provides rapid, organized, and understandable results. As a demonstration, I have inserted videos of myself navigating Skyscape Medical Library. The first demonstration is on using the medical calculator. For example, a nurse has a 150-pound patient suffering from 20% second and third degree burns. She would like to know if her calculation on fluid resuscitation is accurate. She clicks Calculator, then type burns, choose Burns Fluids Parkland, and type in the patient's weight and percentage of burn body surface area. The fluid required is now calculated in millimeters. The next demonstration is on using Skyscape RX. The nurse is administering labetalol by mouth and would like to know the medication contraindications. To do this, click Skyscape RX, type labetalol, choose labetalol oral, and then choose contraindications in the options. The consequences of HIPAA breach can result in penalties such as a fine, exposure of litigation, time in prison, and a loss of nursing license. Thankfully, Skyscape Medical Library does not include any forms of patient-specific information as it is HIPAA compliant. Users are cautioned, however, that medical decisions must be based on the independent judgment of practitioners. It is also the user's responsibility to apply the information from Skyscape appropriately. Lastly, the user must ascertain the Food and Drug Administration status of medications and medical devices published in the application. As has been said, Skyscape is a helpful tool for nurses as it is a quick and easy guide to medications, diagnosis, and medical formulas. It is free and offers fast, organized, and readable information. Most importantly, it is HIPAA compliant. On the other hand, advertisement pop-ups can distract users. It requires internet connection and information accuracy is limited. In conclusion, Skyscape Medical Library application is beneficial to nursing practice as a quick and easy guide to medications, diagnosis, and various tests. It must only be used as an additional source of information and must not be used as a main health information resource due to its limitations in accuracy. Healthcare is ever evolving, and medical facility protocols must be followed along with the latest evidence-based practice nursing recommendations. This concludes my presentation.